The Lower Cross Rehabilitation Plan, developed by Dr. Vladimir Janda, who recognized that some muscles tended towards tightness while other muscles tended towards being weak. This led Dr. Janda to develop a rehabilitation plan that was a very particular sequence. This video is my adaptation and application of his work. I recommend holding each stretch for 30 seconds or 1-4-7-8 breathing cycle. Now proceed to do the half kneeling position with the rear foot slightly outward, the front foot directly below the knee, your back straight, and slightly glide forward. Do not arch your back, but keep your back straight and only glide forward. This is the best way to stretch the iliopsoas muscle, which is known as the hip flexor muscle. Next, I'm going to point to my butt muscle, called the Gluteus Maximus muscle, and after about 10 seconds of the gentle glide forward, I'm going to squeeze my butt muscle to give it some strength training. Now here I'm bringing my right arm overhead, which is opposite of my rear foot, and I put a little stretch into my elbow. This stretches the right quadratus lumborum and latissimus dorsi muscle, two really important muscles of the back. Next we proceed to stretch the front thigh muscle, called the quadricep. This does require some balance, and you might want to put a cushion underneath your knee to make it more comfortable. Next we proceed to stretch the piriformis muscle. Place your foot in front of you as shown, trying to keep your ankle even with your knee. Ideally, we can get our hips flat on the floor along with our thighs, but don't try to force this. Hold the position with as much ease and let the tissues gently stretch themselves. The ultimate goal is to try to get the thigh and knee flat to the ground. This may take some time. At the end of the video, I show you another way to do this same stretch. From here, we can go straight into the hamstring stretch, trying to put your foot as far out in front of you and trying to get your knee as straight as possible. This also stretches the groin muscle, also called the adductor group. When you're done stretching the hamstrings, you can easily move into position to stretch the opposite hip flexor muscle. Right foot back with the right heel slightly outward, slight glide in my hips while I keep my back straight. Consider this sequence 1 of this routine. Then sequence 2 would be squeezing the buttocks muscle called the gluteus maximus as you're slowly gliding forward and backwards. The gluteus muscles are opposite of the hip flexor muscles. The combined efforts of hip glide with butt squeeze helps to improve and maintain hip muscle balance. Sequence 3 would be the latissimus dorsi quadratus lumborum stretch. The fourth and final sequence will be the thigh stretch of the quadricep muscle. Do each stretch or sequence for 30 seconds or 1-4-7-8 breathing cycle. Next we proceed to stretching the piriformis. Again, trying to put our foot out in front of us, trying to keep our ankles parallel with our knee, but not forcing our hips too far down for the point of discomfort. If this is too uncomfortable, you can bring your foot inward, which will also stretch the piriformis, but ideally we can keep our foot even with our knee. And then from here, we move into the hamstring stretch. Trying to put our foot as far out in front as possible. Trying to keep our knee flat and reaching for our toes. Now I'll demonstrate the alternative way of stretching the piriformis and the hamstring. Starting on your back, take your one leg and bend it over the other. You can take your foot and put it over the opposite knee as shown. When you're completed with this stretch, you now bring the bottom knee upwards into a figure 4 position, which allows you to stretch the piriformis in this manner. I like to do a gentle oscillation in the first 5 seconds and then hold it for another 25 seconds. You then can bring the bottom knee upwards and pull even harder to get a deeper stretch, and hold this also for 30 seconds. This then allows you to move straight into the hamstring stretch, as shown, trying to get your leg as straight as possible in the air and bring your knee as close to your chest as possible. Pulling your toes towards you also helps stretch the posterior muscles of the thigh, including the hamstring. Now after 30 seconds, or 1 4-7-8 breathing cycle, repeat on the other side. Next, we move into the child's pose in order to stretch the latissimus dorsi muscle. There are 2 effective ways to do this. The first, as shown, using the floor and trying to get your buttocks as close to your heels as possible. You'll notice that I'm gently bouncing up and down, and then I'm holding the stretch for 30 seconds. Another way is using a physio ball, where you rest your arms and eventually your elbows on the physio ball, allowing the movement of the physio ball to assist in the stretch of the latissimus dorsi, as well as your upper back. You can roll out and back for 30 seconds, or you can just hold it out for 30 seconds. Find what's best for you. Next, we move into the butterfly stretch, which is to stretch the adductor muscles or the groin muscles. The most effective way of doing this stretch is to do a slight pelvic tilt of your hips downward. You can lift your body up in the air, let your hips bend forward, and then hold that arched back position. To prevent your back from slouching forward, as demonstrated, you might find this easier to do up against a wall. If you do find yourself slouching, just lift your hips up in the air, let your hip tilt forward, sit back down, and maintain a good posture. Now I'm going to show it to you from a different angle. Bring your feet together and pull them towards your hip. Push your hips up in the air, come back down with a straight posture, and then gently press your elbows against your knees outward for 30 seconds or a 4-7-8 breathing cycle. Next, we proceed to stretch the lower back muscles. Initially, this looks like the piriformis, but then as you extend the foot out, it goes into the lower back. You can hold this stretch for 30 seconds or 1 4-7-8 breathing cycle, and then you switch to the other side. Try to reach your foot out as far in front of you as possible. As you're reaching your foot across your body, trying to touch the floor, be sure you keep your shoulders as close to the floor as possible. Keep your shoulders on the ground and let gravity pull and stretch your foot down to the floor. Next, we proceed to do lumbar flattening and diaphragm stretching. Gently press your spine down to the floor, and I like to do this 10 times. And then after that, gently take your fingers and wrap them underneath your ribs and breathe into your fingers 10 times. This particular sequence does not require doing the 4-7-8 breathing, just some gentle breathing in and out. Now we proceed to the strengthening phase of the lower cross rehabilitation plan. And the first muscle we strengthen is the transverse abdominis muscle. This is the deepest and most essential of the abdominal muscles. First, do a lumbar flattening, then gently lift your head and your shoulder blades off the floor. It is unnecessary to go higher than this. As you go higher, you start to recruit the rectus abdominis muscle, which is the muscle that provides a six-pack, but it does not provide any benefit in the Janda rehabilitation plan, nor does it actually help with the core strengthening. Again, you want to keep your lumbar flat and lift your shoulder blades off the floor. Repeat this 5 to 10 times. The transverse abdominis muscle and the next exercise for the gluteus maximus muscle are the two most important muscles in the Janda rehabilitation plan of the lower cross. This is an 8-step process, and first, find your gluteus maximus muscle and try to squeeze one side alone. Here I am using my fingers as a cue to help me squeeze my butt against my fingers. Step 2 is raising the foot so your toes are on the floor. Step 3 is raising your knees. Step 4 is lifting your whole leg off the floor. Then you reverse it. Toes, knees, flatten the foot, and then you relax your buttocks. Key to this exercise is constantly squeezing the buttocks first. Buttocks squeeze, maintain that squeeze, and then place your toe on the floor, lift your knee off the floor, lift the leg off the floor, and then reverse. Return the toes to the floor, return the knee to the floor, flatten the foot, relax the buttocks. The biggest challenge with this exercise is that you must continue to squeeze the buttocks through the entire sequence. If at any time you lose that squeeze of the buttocks, you stop the sequence and start over with squeezing the buttocks, lifting the toes, lifting the knee, and again, if you lose the squeeze at any time, you return to the beginning and you start over until you're able to continue the squeeze throughout the entire sequence. If all you can do is squeeze the butt muscle for 10 seconds, then do that 5 times. As you do this rehabilitation plan daily, you should discover that you can maintain the gluteus maximus squeeze throughout the entire 8-step sequence. Next, we start strengthening the muscles on the outside of the hip. These are called the abductors, or the gluteus medius, minimus, as well as the tensor fascia lata that is part of the iliotibial band. This technique is called the clamshell, and as you keep your feet close together, you open up your knees, and you should feel a tightening right along the outside of your hip, where my hand is located. Start off with 5 clamshells, and then you will move into the foot lifting sequence. There are 3 phases to the foot lifting sequence. Initially, the foot is in front of you, then it's midline, and then it's behind you. Start off with 5 lifts at each position. Here I demonstrate the same set of exercises for the hip abductors from the backside. Here is the clamshell. Then we move into the front leg lift, then the midline leg lift, and then the rear leg lift, doing each lift at least 5 times. Next, we proceed to a second phase of Gluteus Maximus strengthening. Here we lay on our back and we're going to bring one knee to our chest. Here I'm bringing my left knee, and then I'm going to gently press my left knee into my hands. Not hard enough to move them, but just enough to have a little pressure. I hold that for 10 seconds and then relax. And I will repeat this 3 times, and then proceed to do the right gluteus maximus. This type of strengthening is called isometric strengthening. Lastly, we stand up and start strengthening both the hip abductors and the gluteus maximus with a squat and a sideways walk. Do 5 steps to the left, then 5 steps to the right, and repeat that 5 times. Dr. Janda observed that the muscle imbalance pattern of some muscles being tight and other muscles being weak appeared to cross the spine from front to back. This led him to call it the lower cross syndrome of muscle imbalances.